the basics of social anxiety is one is it's really, really common. So it's about the fourth most common psychological disorder. And we're talking about social anxiety disorder. If we're talking social anxiety, it's everybody, to some extent. Disorder-wise, maybe 13-ish% of the population have it. Unlike most anxiety disorders, it's relatively equal across genders. Important things about it: the disorder itself, so being socially anxious, means people a lot of times don't seek treatment because, that's sort of built into the problem of not wanting to talk about things and show vulnerability and show flaws. So people, unsurprisingly, are more likely to keep that stuff to themselves. There was some research that for social anxiety, people have it for, it tends to present in teens, but most people probably do not end up seeking treatment for it. If they do, it tends to be pretty late. They tend to have it for a long time, potentially around 15 years, even though treatment is available and it is helpful. So this is part of just my spiel about how social anxiety is, we deserve to know more about it. A lot of times people are more likely to present for depression when social anxiety is actually the bigger issue. We know research-wise that social anxiety comes first, but it does tend to lead to depression and to substance issues. And it looks like, you can't do sort of full clear research on that, but there's definitely, it comes first and it seems to lead to it. It is chronic and unremitting. This is one of the phrases you see in the research on this. Chronic and unremitting, so it tends to stick around, doesn't go away on its own, tends to sort of get worse over time. So people tend to have it for a long time. So it is worth treating. I won't get into this all, but it has a lot of very important kind of impacts on people. Because, right, it gets in the way of connecting with people. That's really what I focus on. It gets in the way of that fundamental human need to connect. And that's a lot of where the joy in life is connections with people and being known, having the true self be known, be authentically known and accepted. DSM-wise, there's a fear of scrutiny and fear of being judged. And, importantly, there is a piece in there of the idea that it's exaggerated. We won't focus too much on that because it's pretty boring. I want to get at a more kind of in-depth understanding that's more useful for treatment. I've included some measures that you can use. I use the SPIN. You can actually go online and find the SPIN where you can actually punch in the numbers and it will give you mild, moderate, severe, so you can get a sense of where people fall on that. I like to use that also at the beginning, sort of middle, end of treatment to be seeing, is there a noticeable change? People like this too. They can come and say, oh wow, I'm very severe, and here we are, some chunk of the way through treatment, and I'm doing better. That helps people feel like they're making progress. Because sometimes, and you've probably noticed this in your own treatment with people, you can see a difference, but they're in whatever position they're in at the time, so they may not feel that. They might be thinking, oh, well, I'm struggling with this thing right now. I can see, well, yeah, but you were in a different place a couple of months ago. So it's nice to have these measures where you can go, oh, okay, yeah, you were at a 32, now you're at a 21. That's a big change. Other common ones, the SPS and the SIAS. Those are generally sort of done together. I've got references for you in the slides. Okay, so that's the kind of boring stuff. Now we're going to get into kind of the meat of this, the treatment. So what I want to get across is how to understand social anxiety, because if you understand it, then it becomes clear how you can treat it, because there's a science to this and there's an art to it. So if you really understand the framework, then you can move around within that framework to figure out how to help each individual person. So I'm going to give you 2 ways to understand it, because I know myself and I lean towards complexity and seeing how different things are interconnected and the various parts of it. So I'm going to give you a simple version, and then I'm going to do my more complex version. So the simple version, and I find everyone who I'm working with who's socially anxious tends to get this simple one pretty quickly. This comes out of the self-presentational model by Mark Leary. So the self-presentational model, as far as I think about it, is social anxiety is the gap between how people believe they must come across to be okay and how they are confident that they will come across or can come across. So this gap, I call this the self-presentational gap, is social anxiety. So if you feel like I have to come across as confident and calm and witty and funny, and yet I believe I'm going to seem really anxious and have nothing to say and stutter over my words, this gap is social anxiety. And in this simple method, treatment-wise, we're trying to close this gap. And most people's instinct is, and part of why they end up where they are, is they believe the standards really are this high. They believe that they really cannot perform very well, and they're seen as being flawed in all these ways. And the only way to close this gap is they've really got to perform much, much better. And treatment-wise, what we're looking to do is we really want to lower this belief in these high performance standards down from what oftentimes is not very realistic, sometimes perfectionistic, down to like what is actually acceptable. Like we're testing out the environment and their world to find out like what is really acceptable. Do you really have to come across this way, or can you be basically kind, basically curious, and share a little bit about yourself, and that's fine? So a lot of work in bringing this down, testing this out, looking at other people, but really testing it personally. I like to give the example of the blurters of the world, which are basically those extroverted, low social anxiety people that everyone seems to know, who basically go around just blurting things out all the time without any of that filtering or self-consciousness or examination before we say things. The blurters set a nice example of like the way that the standards might be a bit lower, because I'll often ask people, those blurters, those low social anxiety extroverts, do they ever say things that you would never say? Do they ever say things that you think are kind of like sound stupid or uninformed or you'd be embarrassed about? Everyone's like, uh-huh. And I'm like, well, how are their social lives looking? How are they doing? Generally pretty well, So this is part of trying to bring this down. A lot of testing on this. The other half of this in closing the gap is it's really bringing up the perception of how well they're doing. Because we know this from like a lot of research that people with social anxiety, they come across a lot better than they think they do. They are very, very harsh on performance, way harsher than the people they interact with, way harsher than an audience of people that will watch like a video. We know this from the research. So we're trying to also raise this piece of getting them to recognize they're actually doing fine. they're doing okay. A lot of times the information I'm doing badly is not coming from the external world. It's not coming from people's reactions and what they're saying. It's internally derived. I felt bad, therefore I did bad. I felt like I should have done better, therefore I didn't do very well. And a lot of times we'll ask, well, okay, externally, based on the information that we can, present in a court of law, what evidence did you have as far as how you did? What went so horribly wrong? Well, nothing really. How did the people around you react? Probably neutral to positive. And that we're kind of working in those ways to try to bring these things closer together, correcting self-perceptions, which are often very skewed and exaggerated, oftentimes like very distorted self-perceptions. So one of the treatment techniques I try to do kind of early, and then I'll mention once we get to treatment, is video feedback. So this is basically you videotape them when they're anxious, interacting with you, and then you have them watch it back. And the internal ideas, the perceptions of how they're coming across are very different, because when we're interacting, we're the only person who doesn't know how we come across. Everyone else is observing us. We are basing it on mostly our internal information. So that's why the video is a lot of times very, very eye-opening. Like I've never had a video feedback session where it wasn't very surprising to the person watching. One person was like, "I cannot believe how normal I look." Yeah, you look normal, because anxiety, and it's not just anxiety, but especially for anxiety, which a lot of people are worried about, I look anxious and I will be judged. Anxiety is largely an internal experience. It's largely not observed by other people. It's how we feel internally. Okay, so that's a lot on the simple one. Self-presentational gap. Must come across like this. Believe I will come across like this. Let's lower that. So hang on to that if you forget all the super complex stuff. Okay, the more complex version of this, and this is, I'm really specialized in this, so I get pretty deep into it. So people with social anxiety believe they are flawed in some way. They have a flaw. And I have an accent, so I have to say, not like the floor of the room. They have flaws. They are flawed. And they believe, because they are flawed, that if they are seen by people authentically, they will be rejected, and that rejection will be intolerable. This is the deep version. And so, believing this, they engage in a series of protective behaviors. And these protections they're intended to prevent rejection. They're intended to hide the flaws, prevent what they see as the inevitable rejection. Unfortunately, these protections, all these ways of hiding and avoiding, they tend to be, they backfire because they're kind of off-putting. And which can mean they end up sort of inviting the rejection that they're designed to prevent, and they actively stop the ability to connect with people, which is, on the deep level, what everyone is looking for. People want to connect and they want to avoid rejection. And these protections will cut that off, stop that from happening. And as we look for these safety behaviors, we call them the protective strategies, we'll notice each of these in turn, they backfire. They mean people come across worse and are unable to connect or show parts of themselves, show themselves in order to connect. And then this is this is where the real suffering of social anxiety is. I work with people, some who have a pretty simple case of this, and some where it's very, very deep and it's lifelong, like very, very hard to connect with anybody. And so it can be really painful because we have this deep, fundamental human need to connect with others. And the belief that we're flawed and the protections we put up prevent that. The model that I use for connection is a model of mutual self-disclosure. So in order to connect with people, we basically need to self-disclose, show who we are, so people have something to connect with. And we need to ask them who they are. So showing curiosity, because then we can connect with them. And we know from research that either side of that, people like it. Like if we self-disclose, we like people better, they like us better. If they self-disclose, we like them better, they like us better. There's a mutual self-disclosure, and over time we get deeper and deeper with that. Social anxiety and the protections that are part of it cuts off that ability to connect. So that is the more complex, deeper version. Kind of in action, like what this looks like. If someone with social anxiety thinks about entering or enters a social situation that's triggering for them, it lights up a series of beliefs. And these beliefs are important because this is what we'll target when we're trying to treat. And these series of beliefs are, and this I call this the social anxiety equation because it's sort of a way of understanding this. They are: 1, my flaws will be revealed. 2, people will notice my flaws. Because if my flaws are revealed but no one pays attention, it doesn't matter. So there's a belief the flaws will be revealed. Other people will consider these to be flaws. They will be judgmental of the flaws. This will lead to a harsh rejection. And that rejection will be intolerable. And this is not like people are sitting there like thinking all of this. This is like, brrr. It all goes by at once. I enter the situation, brrr, this all happens, and then basically the threat system kicks in. And the threat system is, an ancient system designed to help us survive. So it believes all these things, kicks in, and so then we get into all our defenses kick in to survive. Self-focused attention to see how we're coming across, to try to not screw up and not have those flaws revealed. Those high performance standards kick in. I better perform really well so that I don't get seen and judged. Worry and rumination. Worry to try to prevent doing something wrong. Rumination to examine what happened and try to stop it happening again in the future. Involuntary submission, which is this sort of pull down to like look away and hide, collapse. The urge to escape, or the physiological fight or flight feelings. And then those protective mechanisms of really like filtering, not self-disclosing, not asking questions, trying to perform really well, not showing anxiety, all those things that are the quintessential social anxiety protection mechanisms. So this kicks in and then cuts off connections. So what we're trying to do in treating this is we are trying to help people drop the protections, because we can't do anything if the protections are in place. So we're trying to help them, in general, drop the protections, accept the flawed parts of themselves, the imperfections, the vulnerabilities, which we all have, and therefore it's acceptable. So accept those parts of ourselves and then have them show themselves authentically to other people. That is the deepest level of what we're trying to do here. And The idea is they will have to learn to cope with the fact that they are not going to be a fit with some people. There will be rejections. I like to characterize it as not being a fit. And that is okay. You can cope with that. And the reward is by having those protections dropped and by showing the true, authentic self, they will have actual, genuine connections. People will know them and like them. And on the deepest level, what we are all looking for is to be accepted and loved despite our flaws, for the whole person that we are. So that is what we're trying to do. We have to pull back all those protections so that new information can get in, and so that we can update those series of beliefs that kick in the threat system and shut us down.